Hi guys, today we're going to be talking about something which I think I've probably overlooked slightly in what I've written so far. So today we're going to talk about care of the elderly. Now, the elderly are actually one of the biggest sections of the population who are affected by health and social care in Britain. It affects them in a very similar way to how it affects disabled people, like myself, although the elderly are far more likely to go into care homes and have to use social care than they are NHS continuing healthcare. I would have thought. The most widely publicised thing about elderly care is the fact that a large number of people have to sell their homes to pay for their own care. I believe 40,000 people last year had to sell their homes. And there's been a large public outcry about this. And actually, as far back as 1997, Tony Blair promised that under him, he would try and stop the situation when people were having to sell their homes. So it's been going on for quite a long time, and it's something that the government hasn't sorted out. Now, I believe they're publishing, I think it's a green paper, I'm never sure what colour paper it is, but I'm pretty sure it's a green paper, I believe next Tuesday, hopefully, although I think it keeps getting delayed, about long-term care of the population, particularly the elderly. Now what they're suggesting, or the rumblings, or the rumours that are going around at the moment, is that they may well suggest that they have a new form of almost like, I suppose, health insurance rather than inheritance tax, by which people can pay either when they reach retirement or on death. It would be around £12,000, and effectively it would mean that the government would then pay for any care that you needed. Now it's actually quite good because a large number of people have to pay between £300 and £400 a week to have their care delivered by social services. That's an average. It's very much variable across the country. It's the postcode lottery system really. And in some areas it's free. In Scotland it's always free. In some areas it can cost up to £600. So it's very, very expensive. So a one-off payment of £12,000 actually isn't a bad deal. And if people know that they can pay that in advance, they can save up for it. So I don't actually think that's a bad deal. But I'd like to know what you guys think, and I'd like to know what you think in general about who should pay for the care of the elderly. Okay, that's me. I've been George Baker. See you later. Please visit my blog at www.howtogetcare.com/blog. There's lots of useful insights on there to do with health and social care. Alright, bye.